Hi, my name's Jade Taylor and today is the 26th of September. My student number is 251554666. I'm now going to demonstrate 6 skills. I'm going to demonstrate the triple airway manoeuvre, OPA, MPA, lateral position. I'm also going to bag valve mask and the laryngoscope. I also have my safety precautions, gloves and goggles. I'm now going to demonstrate the triple airway manoeuvre. In this position, if with an adult, we place a 2 to 5 centimetre pad under the head. If they're a child, we place nothing, and if they're a little child, we place a towel under the bottom of their shoulders. So as you have the head here, I'm now going to do the head tilt chin lift, and this is where I place my hand on the centre of their forehead with my thumb facing the nose. I'm going to put my thumb here, and I'm going to put my other fingers across here, and I'm going to lift back and bring the chin up. Common error with this is that you squeeze too hard on this area, blocking their airway. Doing this also makes them supine, so we've got a straight curve for the body to be able to breathe the airway in and out. With the jaw thrust, I'm going to place my 5th, 4th and 3rd finger on the mandible and my little finger just underneath. I'm going to place my thumbs on the zygus and protract the jaw. This also helps in order to bring the tongue off the back of the mouth so that there's a clear airway through the back of the rest of the throat. With the chin lift, it also does that as well. Thank you.
Why?
I will now demonstrate the OPA, oropharyngeal airway insertion. Indications for this is when they are unconscious and they have a bite block. Contraindications for this is trimmus and gag reflex, which can cause vomiting. I will now measure the OPA against the patient's mouth. We measure from the flange of the lips to the mandible jaw with the other end, so it's a perfect size. We normally put water or saliva on this in order to lubricate it. On the insertion, we have this part facing the head, and then we insert it halfway and at 180, and then I turn it 180 degrees and insert it the rest of the way to the lips so the flange sits there. The idea of having it this way on insertion is that we keep the tongue, doesn't push the tongue towards the back, and then when we push it in, it keeps the tongue pushed forward. For a small child, we just normally insert it straight like that, or if you need help, you can use the laryngoscope to help you with that. A common error for this is that people jam the flange between the lips, which causes trauma to the patient.
1.
I will now demonstrate the nasopharyngeal airway insertion, which is also known as an MPA. Indication for this is unconsciousness and trimmus. Contraindications is middle third facial fractures, significant nasal trauma, and TBI. Pre-indications of this is nasal skull fractures and CVS fluid from the ears and the nose. I will now insert this. So we measure it from the nose to the earlobe, so it's a perfect one. We put in the triple airway manoeuvre. We lubricate this up so it goes in nice and easily. The common error with this is people make it too long, and if it's too long, you just need to leave it out a little bit. And make sure you don't push this in too far, that's also another common error. So we insert this and we twist it 45 degrees, clockwise and anti-clockwise, till it inserts. We don't insert it into the esophagus, otherwise it causes trauma, but we still need to make sure there's adequate oxygen going down here, so we maintain this with the triple airway manoeuvre. So once this is down and in, we should be able to see that the patient is able to bring air out of there. It also supports the tongue forward so it doesn't block the airway. I'll now demonstrate the laryngoscope, which is used to check the airway. I'll make sure this is secure, the light bulb's on secure, and that the light is on. I hold this in my left hand, suction on the right. I will slowly insert this on the right side, and I will slide it across to the left, making sure that the tongue is left in this groove here. Once this is across, I will hold my thumb up here, and I will gently check the airway up the top, and then I will slowly pull it up and back to check the vocal cords, while placing this in the vallecular groove to see this. I will then gently put it back down and slide it across and back. A common error with this is that people pull back too much, damaging the teeth on the individual.
1.
Okay, I will now demonstrate the bag valve mask, also known as BVM. We have to make sure we have the right size correct mask for the patient, which it is, that this is inflated around there so it gets an adequate seal. I stand at the head of the patient and we place it on here. We make sure we have our C-cup position with the 2 fingers across here, the thumb here, to provide an adequate seal, the other finger just under the jaw here. We do we usually do 12 ventilations per minute, which means one per every 5 seconds. This patient's roughly 80 kilos, so it means 80 times 10 is 800 mils. So I'm just going to show you now for 15 seconds. While doing this, we make sure that the air is going in nicely and that it's not inflating the stomach, as that is a common error within the body. Okay. I'm now going to demonstrate the lateral side position. With this, we check there's no syringes, no dangers around, so we check their pockets when rolling them over. We place this arm out nice and wide, and we place this across their chest. We bring their knee up, and then we slowly just roll them over using the shoulder and that. And then we bring this knee up to make sure the position's nice and stable. We bring this arm down, and we make sure the head is tilted so that the fluid can drain out. The common error with this is when it's overextended. If there's a third person, you can also use them if there's more spinal injury.